Sleep is absolutely essential for someone to have the ability to function both physically and mentally. But what if someone has problems sleeping? We spoke with Dr. Sterling Malish at Good Samaritan Hospital in Los Angeles and asked him what's keeping many of us from having a good night's sleep.
Sleep is a complex process involving the brain and many systems throughout the body. So a sleep disorder is a disturbance of any one of those processes that would otherwise be promoting normal sleep. 20 million people have sleep apnea. Even more common than that is insomnia, which goes an order above that. Then there are other multiple types of disorders all adding up. We could say easily over half the population has a sleep disorder at some point in their life.
How does someone know they have a sleep disorder?
Sometimes they'll notice excessive daytime somnolence, or they may notice something towards the opposite end of the spectrum, meaning they can't fall asleep, or simply mood disorders, or even unpredictable type of symptoms such as leg swelling or seizures at night. One of the best tools we have for diagnosing sleep disorders is the in-lab polysomnogram, or as commonly known as the sleep test or sleep study.
Can having a sleep disorder cause a shortness of breath when you're sleeping?
There are several types of disorders that can do that, one of which would be, and the most common of which would be sleep apnea or obstructive sleep apnea. The other type would be central sleep apnea. There's also a condition called nocturnal laryngospasm, whereby the airway muscles in the upper airway can lead to a muscle tightening at night. And that can be precipitated by various factors, the most common, or one of the more common of which could be gastroesophageal reflux or GERD. A patient who's been diagnosed with obstructive sleep apnea, the gold standard treatment is something called continuous positive airway pressure, or CPAP, and that basically it's a mask that will fit over the mouth or nose or both, depending on what's most comfortable. It blows in airway pressure. It's not oxygen, but airway pressure only, and it will help keep the airway open at night. Depending on certain parameters of the sleep study and the physical exam, clinical evaluation, there may be a number of alternative treatments available besides CPAP if it's felt clinically appropriate, but that decision really can only be made by a specialist in this field. If someone has insomnia due to obstructive sleep apnea, you treat the obstructive sleep apnea. If they have insomnia due to a circadian rhythm disorder or a misalignment of the body's internal clock that tells the body when to sleep, then there are certain treatments such as melatonin or light therapy. So the treatments for insomnia for any particular patient can be very different. There's something called delayed sleep onset syndrome, or the syndrome of staying up later and later at night, up in front of bright lights, computers, TV screens, all the things that teenagers like to do, and that can certainly set a cascade leading to delayed onset sleep phase syndrome. For all age groups and populations, the risk of obstructive sleep apnea actually increases as one ages.